All right, their job is to take special care of your furry companions. Dr. Carla Rodrigues is a certified canine rehabilitation practitioner at Affiliated Veterinary Specialist. You are here on a very special day. You've got some guests, and we'll get to them in a second.
We do. Thank you very much for having me.
Yeah, of course. All right, tell me a little bit about AVS.
So AVS has been serving North Florida for about 20 years, and we have 4 locations: Daytona Beach, Jacksonville, Orange Park, and Gainesville.
Very cool. Tell me about your role over at AVS.
I'm a certified canine rehabilitation practitioner.
So what does that mean?
So I rehab and help the patients past surgery, arthritic patients, neurologic patients, any sort of condition that compromises the musculoskeletal system, joints, and that causes any sort of discomfort in our patients.
All right, well, you're talking about some of your patients. Let's make our way over here. We're excited. You brought some special guests with you today.
Yes, this is Lisa Klosterman and Louie. Louie's a 14-year-old miniature poodle. He came to see us when he was having a lot of trouble walking because of some knee issues.
All right, let's go into that. Explain a little bit more about Louie's story.
So Louie had bilateral luxating patellas, which means when your kneecap doesn't stay in place. And before he had surgery and rehab, he was having a very hard time walking. And because of that, as you'll see in the video, he had a lot of muscle contracture, which is a big part of our goal in rehab, is to loosen up those muscles and to keep the range of motion of those joints. And our priority is comfort and quality of life.
All right, so Louie looks great now.
He does. He looks fantastic.
You said he's your all-star patient?
He is. He is our all-star patient.
And Lisa, tell us a little bit more about Louie and how AVS has affected your life and Louie's life.
Well, Louie had had 2 surgeries prior to coming to AVS, and there had been no physical therapy, and the surgeries had failed, and he actually walked worse than he had before the surgeries. And I didn't know what to do. I'd kind of lost hope, and someone suggested coming to AVS. And between doing surgeries with a lot of rehab, Louie is able not only to walk, but he can run, and he's like a different dog. And they did such a great job. It was such a wonderful experience. Everybody was so kind and caring, and I just, I can't thank them enough because they saved his life.
Yeah, that's great. It's amazing how dogs become a part of your family, and so it is that AVS saved a member of your family.
Yep.
And you said it even got to a point where you didn't even know the next step. The next step could have been...
I had no hope. Yeah.
Well, that's amazing. All right, Doc. We brought an agility course here.
We have.
So we're going to show off some skills.
Yes.
All right. Let's see. Come on, Louie. And when you come, now when a dog comes to you and needs this rehab, why is it so important, for these dogs? Because they go through the surgery, but why is the rehab so important?
So quality of life and comfort are our 2 biggest priorities in these guys. And it's important because even after surgery recovery, these guys need help recovering, again, muscle tone and range of motion, but a big part of it is pain relief. So when we support them through it, they tend to recover so much better. And in Louie's case, if he hadn't had rehab, he would not be walking like this on his own.
It's pretty amazing. Now, Lisa, you said that for years that he did agility. Louie did agility courses?
Competitive agility. He did for 10 years, and he was really quite good at it.
Doc, do you think the agility had something to do with maybe Louie's injury? Is that the reason?
So.
You don't? Wow. But it's so cool. Louie, show off one more time. Look at that.
Come on, buddy, come on.
Louie's the real star of the show. Oh, he graduated too. I was just told we've got an awesome picture of Louie's graduation.
Yeah, he graduated from rehab.
That's so great. Now, what other dog should, if somebody has their dog at home, why would be another reason to reach out to AVS?
Yeah, so our post-op patients are important, but we also see a lot of neurologic patients that need help with coordination and walking. We see a lot of seniors with arthritis. We can't forget those guys. And we can also see patients that have trouble managing their weight a little bit, the overweight guys.
Sure. So I'll bring my 125-pound Great Dane to you.
That's right.
Maybe so.
Bring them on.
Well, thank you all for
You're
coming. This is great. Affiliated veterinary specialists are the best. So special thanks to them for sponsoring this segment. For more information, visit avspethospitals.com. You can call the Jacksonville office at 904-646-1287 or call the Orange Park office at 904-278-0287.